The whole goal when you first meet a patient is to make sure that they have realistic expectations. So, and that that they're doing it for the right reasons. I mean, it's if somebody comes in and they feel like they're being coerced by their spouse to have something done, that's not really a good person to operate on. Or if it's somebody who has just very outrageous expectations of what they're going to have, or if it's somebody who has something that's a very, very minor defect, but they seem to have it very blown out of proportion. Those are people that you just want to make sure that they're doing things for the right reasons. And then a little bit, going over the procedures, answering any of their questions. Obviously, surgery is scary for a lot of people, rightly so, and you just educate them about what it's involved, what the risks are, and then it's ultimately their choice. Duluth is not Beverly Hills. So there are people that make a living doing nothing but cosmetic surgery. I mean, Duluth is not that market. And quite frankly, I don't think I could. My professional goals wouldn't be to just do nothing but cosmetic surgery. I mean, it is challenging, it is fun, but it's also fun to have somebody who's, you're seeing in the emergency room and let's say they have a bad injury to their hand and try to reconstruct that. I think our practice is probably about I guess 25% cosmetic and about 75% reconstructive. And there's obviously, some overlap where there are surgeries that insurance will pay for, but they're also done for cosmetic reasons. So sometimes eyelid surgery can be paid by insurance. If you can show that there's visual blockage, it's essentially the same operation that you're doing for somebody who is cosmetic concerned, so there's a lot of overlap too. And I think we have an excellent group here. We're cutting edge on all the new technology, all the procedures. Quite frankly, I think there's some stuff that we probably do better than surgeons at the Mayo Clinic or in the Twin Cities. There's risk with any surgery. It doesn't matter if you're having a mole taken off, if you're having open heart surgery. So the surgeries that are done by our group are done, if it requires anesthesia, we have board certified anesthesiologists that are involved. We're not just kind of winging it here in our office. So I think we're meeting all the highest standards for safety. That being said, there's risk with anything. And so that's part of what our goal is to educate people, whether the risks, even if they're minor, outweigh the benefits of having the surgery.